Good morning. Welcome to this webinar organized by the Center for Governance Studies. As we all of know, that world is passing a bad time. Indeed, this is a very crazy time for all of us. The COVID-19 pandemic has created an unprecedented global economic and humanitarian crisis, which has enormous impacts on both lives and livelihoods. As a developing country, the magnitude of impacts has overwhelmed the country greatly, although Bangladesh is not new to disasters or major humanitarian crises. But such an unprecedented crisis requires a swift, effective, and transparent governance system to address the challenges and mitigate the emerging crisis. The pandemic has taught the globe to think about the existing governance system and address the loopholes of the system. It is high time Bangladesh should also assess our governance system and address the challenges of the time of the pandemic. With the support of United Nations Development Program, UNDP in Bangladesh, the Center for Governance Studies, CGS, has initiated a project to develop a series of policy briefs to assess the loopholes and challenges of Bangladesh. Under this series, Dr. Ali Riaz, a distinguished professor of Illinois State University, has developed the policy brief on governance titled Searching Ways Forward for Bangladesh in the Time of Pandemic COVID-19 and Governance in Bangladesh. The policy brief has addressed several issues regarding the functional attributes of governance, transparency, accountability, control of corruption, efficiency, inclusiveness, and rule of law, etc. during the COVID-19 situation, and delivered some recommendations based on those issues to utilize the existing resources along with an accountable system of governance. Today, we are going to release our first policy brief, and it's now available on our website. On the occasion of releasing the policy brief on governance, the center has organized this online discussion event. The aim of the event is to deliberate the key findings of the impacts of COVID-19 in the governance system of Bangladesh and purpose the resolutions on how to deal with those crises in the future. We're happy to have with us today Brigadier General M. Shakhawat Hussain, former Election Commissioner of Bangladesh. We have with us Professor Amina Mohsin, Professor at International Relations Department at the University of Dhaka, and Dr. Bodil Alu Mojumdar, leading civil society leader in Bangladesh, will join us very soon. And we have with us our chairman, Dr. Munjir Ahmed Chaudhry. Thank you all. And now here is our key speaker, author of the policy brief, Dr. Ali Riaz, distinguished professor, Illinois State University, USA. Professor Ali Riaz.
Thank you, Zilur, for giving me this opportunity to talk about the policy paper that I had the privilege of writing. And thank you to CGS for taking the initiative to publish this series of policy papers, which I hope would help Bangladeshi policymakers to look, or at least take a second look at the current situation, particularly when the vaccine is about to be available and has been available in Bangladesh, but the question of distribution and other issues have come to the forefront. However, with respect to the vaccination, if we wait for a moment to talk about it, we need to look into how the COVID situation has been tackled by Bangladesh. There's no doubt that one thing that has happened, fortunately, in case of Bangladesh, that the death toll has been very low compared to, say, for example, where I am speaking from, the United States and Europe, particularly in the case of the United States, it has been badly managed and severely affected hundreds and thousands of lives. More than 400,000 lives have been lost. Bangladesh is fortunate to have this situation where the death toll has been low. However, whether the official statistics do reflect the exact number seems to be in doubt. Nevertheless, we need to look into the governance question because the COVID-19, which is a global pandemic and has not only ravaged Bangladesh, it not only ravaged the United States, of course, as a global pandemic, it has ravaged the whole world. And it has brought almost at the beginning, at least, in last year, so between March and May, if you take, practically the global economy was halted in some ways. We have seen the gradual return of the economic activities, but it has raised a serious question with respect to how the governance is actually delivered. And the question of governance seems to be at the forefront because any pandemic, and for that matter, any public health crisis, provides two kinds of opportunities. One, to deliver the services that is immensely important, an integral part of administration. Deliver what is the citizens need, deliver what is absolutely a responsibility of any governance system. On the other hand, we have seen not only in case of global pandemic like COVID-19, we had also witnessed during the Ebola crisis that it actually offers an opportunity for unscrupulous businesses, corrupt practices, and not to mention the system that would practically remain clouded in secrecy. Those are the things we have seen. So there are two paths to take. Either be responsive, and being responsive means that practically in this kind of situation, particularly when we are talking about public health crisis, it means that it needs to deliver to those who need it most. And public health crisis like this, COVID-19, have, though it is the public health crisis to begin with, but it is also a crisis of the economy. For example, when the COVID-19, the pandemic hit uh, everywhere, take any country, what we would see, those who are on the bottom of the ladder, socially speaking, economically speaking, marginalized, whether they're because of the race, I'm talking again, given the United States, we have seen how it has hit the uh, uh, minorities, particularly African American community, Hispanic community, and the Asian community. So those who are on the bottom of the ladder, they need the help first. And in case of economy, most of the time it is related to those who are in the informal sector, because in some cases, the formal sector seems to take care of it a little bit better than the informal sector. And given that Bangladesh economy has largely for the last decade or so on the informal economy, it seems that it has affected the people most are in the informal sector. So with those kind of situation, that on the one hand is these pathways, either you take a pathway of responsive governance, or you take a pathway of shrouded in mystery, clouded by the corrupt practices, and not actually delivering the people who need it most. It was at the crossroads that Bangladesh faced in the beginning when Bangladesh first saw the impact of COVID-19 in March 2020. What happened since then? In my brief, that is what I've tried to look into. Uh, and here, one thing we need to be understanding, whether we are talking about Bangladesh or elsewhere, and particularly in this instance, Bangladesh, that the governance related to a crisis cannot be separated from the governance that has been prior to the crisis. The crisis management or governance during the crisis is shaped by, steered by, and built on the governance that is already there, the system of governance. So in case of Bangladesh, the economy that we have seen uh, coming to 2020, especially the beginning, was already in crisis. There are several indicators which were showing that the Bangladesh economy is facing the sort of downturn in many instances. Most importantly, the inequality over the last decade or so, and particularly the last 5 years, we have seen going into COVID, it was increasing. And, and not only that, we also saw that the level of governance, the mode of governance seemed to be mostly lack of transparency, lack of accountability. Those became the hallmark of governance in Bangladesh going into in 2020 when the pandemic hit Bangladesh. So taking that as the point of departure, what we need to see how Bangladesh has dealt with the COVID-19. One way to look into this is to just to look at the numbers, meaning that numbers such as how many people were infected, how many tests were done, how many people were hospitalized, and so on and so forth. Yes, that is important. However, we also need to look into how it has impacted the not only delivery mechanism, but also the approach towards the crisis. And that is what I try to look into the brief. Uh, when we're talking about governance, governance is not an abstract idea. Conceptually speaking, we might talk about governance in a vacuum, but governance is, at the end of the day, is a matter of pragmatically, practically, a matter of implementing the policies. The policies do not come from vacuum. They are directed by the vision and the politics of the country. Hence, what we have seen in case of COVID, which struck me most importantly, that we need to look into first the criteria upon which we would consider the, the performance of the governance in Bangladesh. One thing, as I've said, the point of departure, at least for me, is the pre-COVID situation. One hand, it was the economic situation in a downturn, particularly inequality. Second element of that governance was that lack of transparency and accountability. These two factors have shaped how it has been responded to. I mean, the COVID situation has been dealt with. And in this instance, uh, uh, if we take the six criteria, which you have referred to, those are the ones that I want to look into is the governance, accountability, control of corruption, efficiency, inclusiveness, and rule of law. And in this instance, or in these cases, if we take, for example, the transparency case, and the Bangladesh initially uh, uh, responded to it very slowly, and repeated claim of the preparation, the preparedness, we have seen how the public health system failed to deliver, not because public health system was not ready for this. Largely, this was a build-up to the crisis, meaning that over the years, how the public health issue was dealt with in Bangladesh, that shaped how it has been responded to. We have seen for a long time that there's been very little amount of investment in public sector, particularly in health sector. So that has resulted in. However, when the situation started, COVID situation started, there were repeated claims that the hospitals were available, the facilities are going to be there, the tests will be done. Those were not done. In many instances, press reports as well as anecdotal evidence to suggest that people were turned away from hospitals. There were not enough ICU beds, and so on and so forth. But the lack of transparency became very clear in this situation that people didn't know. The citizens were unaware of what is going on in the public health system. So if we take that as a matter of, as a criteria to judge, not only at the beginning, it has happened elsewhere too. I mean, no government was prepared. Bangladesh was no exception to that. I understand that, and I do agree when people are saying that we were not prepared, despite the claim of the government. I think it was not unusual that the government was not prepared. What was ill preparedness and the lack of transparency has actually accentuated the problem. That is why the lack of transparency that was prevalent and became a principal hallmark of Bangladeshi governance over the last decade and beyond, you know, that turned out to be deciding factor with respect to the COVID-19 pandemic, addressing the problem of the pandemic. The second thing with respect to transparency is how the steps were taken. I mean, with respect to building forming a committee, whether public health officials were there, whether the situation was dealt with in consultation with the larger population and experts, public health experts. To give one example, the government has initially took a long time, not until May, if I recall it correctly, and as I have mentioned in my policy brief, not until May, government has not moved into the cash transfer program, despite the fact that it was well known, very much well known to everybody that the Bangladesh economy depends on these informal sectors. And how that has contributed, recent data clearly show that the poverty rate has doubled, close to 40%. Why? because the intervention that was necessary, that hasn't been done. And that is where the transparency thing came in. If there were a very transparent process, and that leads me to the second point of the accountability. If there was a process of accountability, what we have seen, the rampant corruption in distribution of relief materials, rampant corruption with respect to the cash transfer program. Whereas all these things could have been addressed if, for example, the large networks of NGOs that Bangladesh has. And Bangladesh can actually take pride in this NGO network. Say, for example, and this is very important going forward in terms of the vaccination, that Bangladesh has been successful in immunization program. Will that network be used? Which would mean that cooperation with the institutions which have been at the forefront of delivering polio vaccine to Bangladeshi children, immunization program, where the NGOs and have been very much successful. So what we have seen already in the beginning of relief operation with cash transfer, the rampant corruption that we have seen is a reflection of the lack of accountability and transparency. And lack of accountability is is present not only with respect to this ground level operation. Bangladesh, since hit by this COVID, have sought, and quite rightfully they might have sought, uh, external help. Bangladesh borrowed significant amount of money from international financial institutions, multilateral organizations such as World Bank, IMF, Asian Development Bank. Uh, where are those money going? Who is actually overseeing those things? We need to understand that these monies that are being provided by the Asian Development Bank, the World Bank, and others are not free money. These are not doling out money. Bangladesh at one point will have to repay those things. And it is the Bangladeshi citizens who will have to repay. So a clear understanding that, where the money is coming from, where it is going, how it is being used, it is a different situation. There is no overseeing mechanism that is being attached to this borrowing. Similarly, with the vaccination program, now that Bangladesh is entering into, like many other countries, into the vaccination program, they need to come up with this transparency and the accountability mechanism. And that's why I have suggested, as a part of my recommendation, that I have suggested that there should be creating an oversight mechanism comprising of experts, non-governmental organization and the public health sector, members of the civil society, to monitor various steps taken and resources available. And that should be equally applicable, as I have mentioned, about not only fund distribution, comprehensive strategy to address the present crisis and the way forward, because the crisis would not go away. Already it is there. And as the economists have suggested, Bangladeshi economists, Bangladeshi economic organizations have suggested, the poverty rate has doubled. That means this is not going to go away, even miraculously. That's a miraculously. Tomorrow, COVID is gone. Nobody in Bangladesh is. The poor people are not going to get the money immediately on the next morning. The morning the COVID is gone. They need to be taken care of. How? That is a question that has not been addressed or has not been clearly put in front of the public. And this is the absence of the inclusiveness, the lack of inclusivity that we have seen as a shared mechanism of governance over the past decade has come to play in this context, precisely in the context of the COVID crisis. Each crisis would show that one, because you cannot separate one crisis simply that uh, in a system of governance, suddenly a crisis would be dealt with differently. It's not possible. It's not. We can expect it, we can dream of it, but it's not going to happen. And that is what we have seen: the lack of inclusivity. There hasn't been any national dialogue, so to speak, and if you will, a conversation between uh, experts, science, those who can deliver, NGOs, civil society who can actually raise awareness, and the public administration, who could work closely to deal with this and take forward. That's why I think that one of the thing that I have recommended is to think about a comprehensive strategy going forward for next 2 years. Is the crisis is not going to go away. Let me highlight the last point, which is very important to me, and I think it's important to Bangladeshi civil society as well as media. What we have seen is the wanton use of Digital Security Act, which is to say that it is highly repressive is an understatement, basically. It has created a culture of fear. Why it has created a culture of fear? Because in case of COVID-19, what we have seen since last year's March, April, and I understand CJS has a Digital Security Act tracker, and those data that clearly shows, and others such as Article 19, which is working on the same issue, we have seen that those who have raised critical voices have been uh, dealt with in a manner that is very repressive, silencing any kind of criticism. That is not only shows the government's penchant for repressive measure, but it also shows the absence of rule of law. Those who have spoken out against or criticized the government, whether for its distribution or raised voice against the corruption, or or has pointed to some of the inadequacies of the government, we have seen they have ended up in jail. And beyond that is the self-censorship. People have not spoken in many instances because they fear that there would be, retaliation, repercussion. And one of the critical elements of this Digital Security Act, particularly I'm focusing on Digital Security Act, but it is not only one. We must be cognizant of the fact that there are other ways where we have seen this culture of fear has practically, permeated society. So these repressive measures that we have seen is also part of the overall system of governance. Hence, going back to my point that the overall system of governance seems to have influenced so much of this policy direction. Yet, you know, uh, the fortunate element that Bangladesh has, and many other countries in Africa that you may also notice, that the low number of infection, at least what was predicted or was feared for, the number hasn't gone that up, which is very fortunate thing. Whether it is weather, whether it is policy, we can have this conversation at a different forum. But fact remains that it was very fortunate that Bangladesh didn't get into this. Now is the point is going forward. In going forward, these are the issues. Say, for example, government need to be very open with respect to accepting the inadequacies and criticism, which they haven't. I mean, the government has failed to do so. The governance has lacked the transparency. There is no accountability mechanism, unfortunately, because the parliamentary system, the parliament has become a de facto one-party parliament, and there is no other ways to do it. The civil society organizations have been muted, uh, A, because of the repression, B, because of the politicization, and there could be C, there could be other factors. So in this kind of environment, the a crisis creates an opportunity for unscrupulous things to be done. And that is what has happened. I mean, the level of corruption that has gone up is precisely connected to this, And Transparency International Bangladesh has come up with several reports which have clearly indicated the extent of the corruption in terms of medical supplies or equipments or beyond that, So, and addressing these things, there has to be somewhat an overseeing mechanism. Am I expecting too much? Perhaps I am, but I think at this point, insisting on immediately the government should stop using or allowing the ruling party activists to use Digital Security Act to silence any criticism of the government. It needs to be repealed so that there are openness, at least opportunity to critically examine the government's action. There should be an overseeing mechanism. Some may argue that we have already, that is, the Bangladesh has already passed through the phase. It is now, the COVID-19 is almost gone. We have the vaccine. Vaccine distribution is a major issue. We don't know. I mean, at least I don't know. I haven't seen any media report. What would be the mechanism? How that would be done? Who would be administering? Why the civil society and particularly NGOs are not being involved, who have this enormous experience? You know, so with the vaccination coming up, we need to think that whether this would be a repeat of the cash transfer or the or the relief material distribution. Uh, that's why it is incumbent on the government to take the initiative. But it is also, I take this opportunity because it is this program is jointly hosted by UNDP. I think there is a role of these international bodies. They need to insist on this transparency, accountability, and particularly addressing the corruption issues. If they turn a blind eye, it is not only detrimental to the Bangladeshi citizen, it is also detrimental to their own, uh, commitment. They are committed to this. So with that, I hope these are the recommendations government will take, at least take a look at it, the series that CGS is bringing out, and hopefully we'll have some conversation on this. Thank you.
Thank you very much, Professor Ali Riaz. I hope you all enjoyed this amazing presentation. And now I would like to request Dr. Amina Mohsin, Professor of the International Relations at the Dhaka University, to make her comments. Professor, it's over to you.
Thank you. Thank you very much, Zalur, for giving me the floor. And I would like to thank the CGS and the UNDP for organizing this discussion on governance during the pandemic period. I have a PowerPoint which I would request you to share. But before, I hope it would be shared from your end, isn't it, Zellur?
Yeah.
Yes. Okay. Before I go into the discussion of the PowerPoint that I'll be sharing, just to come back to what Professor Ali Riaz was saying. Yes, it is true. I mean, the points that he has emphasized, that at a time during the period of pandemic, one needs to look into the issues of transparency, inclusion, dialogue, conversation in a much more transparent manner, and societies ought to be more open on this. And unfortunately, we have seen a lack of that. There is no denying that. And as Professor Ali Riaz has mentioned, quite rightfully, that it has been a global phenomenon. It's not that it was limited to Bangladesh. In fact, the global pandemic, it did open up many of the fault lines of the global system. I mean, we saw a total lack of leadership at the global level, and the territorialization on the part of the states, and the rise of ultranationalism on the part of the states. And Bangladesh was at the receiving end in these sectors. Why I say it was at the receiving ends, and I think the global community and or the developed world also has to take responsibility for this. Because if you see the way the migrant labor has been treated, the migrants were treated, they were just sent back. It was utter territorialization of the state. And then once they came to back to Bangladesh, there was stigmatization. People were scared of them. So like all these. That's why I say that these are fault lines. And if one goes to the economic sector also, RMG sector, which is one of the major pillars of Bangladesh economy. There also we observed that the Western countries, they were just cancelling the orders left and right without paying any kind of compensation. So these are factors I think we need to keep into mind, that what happened during the pandemic period. And I'm not denying that there was that when you talk, one talks of inclusion, transparency, governance. I mean, what are we talking of? I mean, there are major fault lines all over, all across the world. And Bangladesh was, as I said, that at the receiving end. And but again, I would say that with the RMG sector, and since Riaz was pointing out that the nature of economy, if we look at the informal sector of the economy, 70% of Bangladesh's economy is almost a informal economy, and majority of them are women. So that became a major crisis situation. And also we found that with the RMG sector, at the initial period, workers were asked to go back to their villages, and it was like internal reverse migration, and that was a major challenge. But I would say that somehow with the when we talk about governance in societies or countries like ours, there are different layers of governance, but there was we also observed, I mean, I wish Riaz had talked about it a little bit. There was remarkable resilience at the community level, and how people came together, and how they faced the situation. People, different kind of mechanisms were evolved at the societal level. So that is something I think one can be proud of in case of Bangladesh. And since it's a policy brief, I would say that the UNDP is involved in it, that how they can invest at the community level and building up community leadership and the informal sector of economy. That is something that needs to be looked at very clearly. Now, if you can share the screen, please, because I would like to, highlight certain points that. Can I have the screen PowerPoint, please? Is it there? I don't see the PowerPoint there.
Asanj, Nazmul, could you please share the PowerPoint?
Yeah, we are sharing. Yes, there's
Please.
now.
Okay.
Okay, this is something like pre-COVID-19, and I'm pointing out at the human security aspect of it. And these slides have been prepared on the basis of you can see a trend analysis from BPO data. BPO is Bangladesh Peace Observatory. It is from the Center for Genocide Studies at the Dhaka University, and you can see the sources. There are national dailies and there are regional dailies as well. So I'm covering certain categories. If you look at, these slides have been, I'm presenting these slides with the hope and expectation that since Riaz is writing on, my God, তো চলে যাচ্ছে আচ্ছা sexual assault. If you look at the sexual assault, if you look at this slide, we can see that that there was a drop, sexual assault decreased by 7% during COVID time, March 20th to November 20, compared to pre-COVID time. And this is a 18 months period. And you can see, one can always say that, this drop was largely because the workplaces were closed or shut down. So this is one, as I said, that I'm looking at the human security aspect of it. So if there could have been, you'll see this drop is there, sexual assault. Can you please move over to the next slide? Domestic violence, can you please go to that? Yes, please. Domestic violence, please. The slide that was before that.
Yeah. No.
Before
previous one. Previous one. Domestic violence.
আগের স্লাইডটা নাজমুল, আগের স্লাইড।
আমি কি আমার কোনো ছাত্রকে আমার ছাত্রকে আনবো এটা ক্ষেত্রে ইয়ে করতে? Please, can you move over to the earlier slides?
Nazmul. Sound.
আচ্ছা,
Yeah.
domestic violence.
এই যে ঠিক
But
আছে
yes, thank you so much. One can observe that there was a rise in domestic violence, 10.3% rise. And I mean, it is detailed over here that the number of incidents and everything is detailed over here. So though there was a drop in the sexual assault, but domestic violence increased during the COVID period. So that suggests that there is a need for intervention where when it comes to the public-private dichotomy or private domain, and one needs to invest more on the side of violence against women. One has to take that into cognizance very seriously, and at the policy level also, policy should be implemented, or policies should be formulated keeping these into context, because these are hard data, as I said, that based on a review of 18 months of for a period of 18 months. Can we move over to the next slide, please? Is violence against children. There also we find that there was a drop of 24%. And again, I would, associate, we have not done any qualitative study as yet to find out that why there was a drop in this, but one can insinuate, or one can make a guess that because people were not coming out and children were not in the streets, people were not working, and we have child labor also. So maybe that's why there was a drop in this instance. Can we move over to the next slide, please? Suicide. You see, the suicide rate, it increased. And that is something, one needs to take into cognizance very seriously about the mental wellness, because the COVID period also brought about, it was a complete shutdown. And this is one area, Riaz was talking about vaccination, public health sector, these are there indeed. But, in societies like Bangladesh, we do not take much cognizance of the mental wellness or mental well-being of people. So this is also another area where one needs to invest on, and policy briefs or policies should be formulated in these areas as well. Then the next slide. Next slide. I think that is the last one. Female suicide rate. There was a rise in the female suicide rates, 20.77%. It's almost like 21%. It increased from the, during the COVID period. It increased from the pre-COVID period. So it has to be, I think this is the last slide. You can just please close it off. What I'm trying to say is that when we talk about female suicide, and if you link it up with the domestic violence, that there was rise in the domestic violence, it does call for intervention, very serious interventions in these areas also. And I mean, why I'm talking on these on these areas, because what Riaz said, I'm fully in agreement with that. But in addition to that, I would like to draw the attention of the Center for Governance Studies, as well as researchers like Riaz and the UNDP, to the human security aspect of COVID period and its fallout. And I mean, these are areas which are under researched areas, and one needs to, particularly the suicide. We talk about domestic violence, violence against women, but suicide and violence against children, I mean, these are quite under-researched areas. So I think that these are areas which needs much more attention and much more research, that why female suicide rate went up so high. And it has to do not only with the women issues, but because we have also seen that the suicides increased during the COVID period. So that has to do with the governance structure, because how would the mental wellness or mental well-being is taken into account, and these are very serious issues. Uh, and I would like to again re-emphasize the point that, you know, when we talk about Bangladesh's economy, we do emphasize the point that in 2020 our foreign remittance was uh, one of the highest, and but one also needs to be mindful of the fact that the migrants were doing stress savings, and they were sending back all they had for their families. So Bangladesh has to think of how to diversify its economy, and how to be more inclusive in its economic sector. I mean, how to take care of the agriculture sector. We have to be innovative on these areas also. We can't just be dependent on two major pillars of economy, which are also, like, so much dependent on the global system, that we face these kinds of problems. Uh, During the COVID situation, Bangladesh was lucky that, we did not face situations where we had food scarcity or anything. It was largely because of the agriculture sector. And this is one area I think that needs much more policy interventions, particularly with the 4IR coming in. One needs to think about that. And also one needs to think about the informal, how to formalize the informal sector of economy. Because we saw that while, uh, while the big shops were shut down, but online business was going on. So that is also one area that needs much more attention. And there also, I think, much more policy interventions are required. I will just stop here, and I will congratulate Riaz for his very comprehensive presentation. And I would urge upon the organizers to look into the under-researched areas as well. Thank you very much.
Thanks, Edith, Professor Amina Mohsin, for your valuable comments. May I request now Dr. Bodilalu Mojumdar, Founder Secretary of Sujan, to take the microphone. Dr. Bodilalu.
Thank you. Thank you, Jillud. Thank you, Center for Governance Studies for...
Can you hear me?
Yeah, I can hear you. Can you hear me?
Yes, we can.
Okay, thank you. And I thank Jillud and Center for Governance Studies for inviting me to this important dialogue. And also thank Professor Ali Riaz for an excellent presentation on salient issues. And Professor Amina Mohsin for emphasizing on the human security issues. These are very, very pertinent, very, very important issues. And these came to our attention more vividly during this pandemic. Well, the pandemic has created many risks, health risks, social risks, economic risks, and also the governance risk. In fact, the governance system, or the lack of it, or governance failure, accentuated the problems, as Professor Ali Diaz rightly pointed out. The health risk could not be minimized, and social issues, as Professor Amina Mohsin highlighted, have really aggravated in some cases. And economic dislocation, all of us know, all of us have witnessed it and experienced it ourselves. Now, the governance failure, the governance deficit, whichever way you want to term it, has two aspects. One is, in my view, I want to look at it from a broader perspective. So the governance issues have representation issues as well as functional issues. And here in this dialogue, we have discussed mainly functional issues. Professor Ali Diaz talked about the transparency, accountability, control of corruption, efficiency, inclusiveness, rule of law. Those are, in my view, are the functional issues of governance. Representation issue is very, very important. Who is governing? And the legitimacy of that, that is also very, very important. And also the representation issue has implications for accountability. There are two types of accountability. One is horizontal accountability, one is vertical accountability. And the horizontal accountability, as we know, is the rulers' accountability through the institutions such as parliamentary standing committees, and the other institutions. But the vertical accountability is through elections. After every 5 years, if the rulers become and beg for votes, and then the people or the voters can show red cards, and that's where the real downward accountability to people is established. And unfortunately, that has broken down in this country. So as a result, now we are talking about governance failure and governance issues. The accountability of the rulers to the people has really disappeared. And they are accountable, they are, or at least they feel that they are accountable to the people who brought them to power and keeping them in power. The bureaucracy and the security institutions. And so they are trying to take care of them. They are catering to them. They are tolerating all the excesses and the corruption and all the bad things they have been doing. So the accountability, downward accountability to people have disappeared. And also, Professor Ali Diaz did bring about the right issues, the trampling of our rights and shrinking of our rights. And he talked about the Digital Security Act. And as he rightly pointed out, that's not the only act that is shrinking this space. And so rights are being violated widely using this pandemic situation, and Article 19 they have documented the rights violations of the pandemic period. So we need to probably more prominently, maybe in another dialogue, we need to probably focus on the rights violation, and that has been widespread, and that is an ominous development that we should be concerned about. Now, Professor Ali Diaz talked about he highlighted some recommendations, and some of these recommendations really represent the symptoms of the disease, the governance failure, and we need to go into the root causes, and we need to go beyond 2-year period he talked about rightly, and he made some recommendations very, very pertinent, very, very important. But I think we need to go deeper. So we need to go beyond. We need to go into the root causes. In my view, the governance system has broken down in this country, and so he did talk about it long term. Unless we fix it, the nuts and bolts of the governance system. And no matter what we do, tinker with things, and we would not be able to really overcome these challenges that we have. I look at the governance nuts and bolts of governance, the functional aspects of the governance issues. Professor Ali Diaz pointed out transparency, accountability, and all those things. The nuts and bolts of what I call nuts and bolts of governance is, I look at it as in the form of a triangle, a tribus. The one triangle, one corner is laws and rules, and those laws and rules must be in the interest of the people rather than in the interest of the rulers. As you know, that Digital Securities Act is not in the interest of the people, it's in the interest of the rulers. So the laws and rules must be appropriate. And unless we have appropriate laws and rules, we cannot fix the governance system. And with the Digital Securities Act and other laws, draconian laws we have, unless we do something about it, the governance system cannot be fixed. So rules and laws. The other aspect is systems. The systems are broken down. Systems don't work. And this morning we read about I was astounded to find this article in Prathama about our central bank, Bangladesh Bank. I never imagined that central bank will be, the senior people in the central bank will be so corrupt and will be taking tolls from these people who have been looting people's money. And as you know, I have been one of the proponent or one of the organizers of this group of people who raised the issue of corruption in the Election Commission. And the Election Commission institution, a constitutional institution, they in the past failed about holding free and fair elections. Sometimes they were partisan, but never before there were allegations of serious corruption against the Election Commission, a constitutional body. So this is unprecedented. This is happening. And this is because the system has broken down. The system doesn't kick in, doesn't right away take action. The casino affair, and nothing happened. And in fact, everything is all the power is centralized. So unless someone gives the green light, the people at the top, and nothing happens because the system has broken down. The process is not working. Another reason, the third aspect of the third corner of the triangle is the institutions. Institutions have broken down, and institutions are not working because of the partisan appointment, because of the all kinds of leniency and the all kinds of the green light people are given. And in fact, in a sense, patronage-based politics. Everybody who is somehow related to or aligned to it or supporter of the ruling party, they can get all kinds of privileges. Not only they can do bad things and get away with it, and with impunity, but also they benefit financially. So patronage-based politics and people appointed in institutions, they can enjoy those benefits and with no questions asked and no retribution. So in my view, the nuts and bolts of governance system is laws and rules are not appropriate. The system has broken down and institutions are crumbling. And unless we do something about it, and in fact, in my view, the governance system has been broken down, has been demolished. It has been a demolition derby. In America, they used to have, maybe they now still have, the demolition derby. So we had a demolition derby of destroying the governance system so that all the power could be concentrated, centralized. If the governance system would work, then the centralization of power would not take place. The power will be dispersed, power will be separated and diffused. So I think we need to really, the root causes we'll have to address if we are to really get out of the mess. Not only the devastation created by the pandemic, but also if we are to go forward, we need to fix the representation issue. We need to do something because we need to ensure that there is a transfer of power in a peaceful manner, in a constitutional manner, in a legal manner, in a peaceful manner. And unless we can fix that, there are prospects of dangers of transferring power through extra-constitutional manner, unpeaceful manner, violent manner, which should not serve anyone. So we need to fix the representation aspect of the governance issue. And also, we need to fix the nuts and bolts of governance, as I said, the triangle. And so those, in my view, are the root causes. And unless we can address those root causes, it will be playing along, and it will be doing what we can do. But in the long run, this will take us to a dangerous course, and we may fall off the cliff. I'm afraid. So with these words, and maybe strong words, I'll stop here. And I feel that we are at a crossroad. We need to do something about it. And the recent developments, the Bangladesh Bank and other things that are happening, we need to fix the governance system. We need to fix the representation. We need to do something about the representation aspect, so that there's legitimacy, there's accountability to the people. And unless we do something about it, I think we'll be in enormous risk of falling off the cliff. Thank you.
Thank you, Dr. Mujumdar. At this moment of the discussion, I would like to request former Election Commissioner of Bangladesh, retired Brigadier General Dr. M. Shaukat Hussain, to take the floor. Dr. Shaukat Hussain, it's over to you.
Thank you very much, Jullur, and thanks to CGS for inviting me in such a important and very high pedestal discussions on the subject. And I congratulate, of course, Dr. Ali Riaz. I'm a fan of for his presentation, and I read through and his recommendations. And also, let me also congratulate, of course, all the time, Professor Amana Mohsen for presenting us with the facts and figures, and to make it very easy to understand through the slides of the human security. And of course, as usual, my good old friend, Dr. Mujumdar, gave out his ideas of the governance issue, particularly the representation issue. So I think more or less the issues which we've been discussing, or which has been identified by Dr. Ali Diaz and Dr. Amina Mohsen, seems to have been discussed very thoroughly. I mean, there's no doubt about it. But looking at, if we are talking about post-pandemic or pre-pandemic, I don't really find any much of the changes of the situation which was pre-pandemic COVID, and during pandemic COVID. I won't find, I don't expect to find much of the changes in the issues that we have discussed even post-pandemic situation. Let me give an example for very small example that Dr. Bodiul Alam talked about the representation. Recently, we had an election in Chittagong, the Chittagong City Corporation. Was that election, I wrote that in my article, was that election even, I forcefully gave 4 out of 10, or was that election even worth 4? Because nobody cared, nobody bothered. But it seemed that the situation was as anybody could do whatever they feel like, in that election and subsequent elections. So we're talking about the representation, we are talking about the transparency, and we are talking about the integrity. Now, if that is there, the institution Dr. Bodiul Alam Mujumdar has talked about, and they have twice applied, we haven't seen any transparency from that institution, or even they are accountable, anybody has taken into account of what they have done. The problem in Bangladesh is nobody owns that there is something wrong. If anything and everything happens, good by nature, or by din of some few people, that is we glorify. For example, yes, we did expect that this pandemic may sweep through Bangladesh and may have a devastating effect, which we thought initially, but it didn't. Whether it is, I won't say it's management, I would say whatever natural causes, whatever the natural causes are. But we saw some of the flaws during this pandemic, though Bangladesh could not be identified as in isolation. For example, we had no clue, no idea when it started somewhere and we got a warning. But then what could we do? Because there was no adequate preparation. Of course, preparation, but no adequate facilities grown based which you could prepare. For example, we saw the naked, absolutely the skeleton of the public health, for example. Though there has been a lot of development in public health in infrastructure, particularly the Upazila health complex and all these things have been coming up and has been there. People have been recruited, but then there was no adequate arrangement at all. There was nobody knew what to do. There was hardly, I was surprised to read that only 4 or 5 hospitals in Dhaka had the ICU facility. And most of the hospitals even did not have the ICU facility. So therefore, the whole sector that we saw, the health sector, which we have been hearing and reading, led by corruption, that was very much proven. But what happened? Not many people have been asked to really come up with why it is like that. Even at the top level, the ministerial level did not find much of the remedy. Now, having said all that, the corruption has rather, I found, increased during COVID situation, which has been already discussed very, very deliberately by Professor Riaz and also by Dr. Amina Mohsen. We also found, of course, the mental health Dr. Amina Mohsen talked about. To me, what is going to happen to our education system? What is going to happen to our education standard? Now we have 100% people passed through whatever mechanism is. And Dr. Amina Mohsin is very much connected with the higher education. What would be their future? How would we compensate that? And the universities are closed, the colleges are closed, and schools are closed. It's not because somebody did it, but it was because the pandemic. And the problem is that how we are going to face this problem in post-pandemic situation. This has not been discussed. These have not been, even in the discussed in civil society, I'm sure I haven't heard being discussed in our academia. So what is going to happen in the next future? A particular generation which is going through this pandemic. My second observation, this is my bigger observation. My second observation that we saw some social decay. I'm not talking about the domestic violence. I'm not talking about suicide. Social decay, in a sense, if you recollect, there were cases where a mother or father having attacked in COVID has been thrown on the wayside or in somewhere in bushes. Maybe very few cases which has come to notice. But then it shows that during this crisis period, we had a mental problem and a social problem both. So I didn't see Amina Mohsin talking about it. Maybe that is very negligence, but it's definitely not a negligence issue. It's a social decay. Regarding the post-pandemic situation, we're talking about poverty, which, as Dr. Riyaz says, has gone up by 40%. But then somehow the Bangladesh economy had remained more or less stable and better than many of the subcontinent countries. That's true. But then corruption has increased. I don't know how this is going to be mitigated, but this will not be, I don't think this would be definitely addressed as long as the transparency and the governance. It's a bigger governance issue. Of course, there is no opposition. There is no voice raised in that because of the Digital Security Act and other acts. Those who write, even they are very careful not to write things which may annoy the government. If the government is not open going through this pandemic, then these recommendations would hardly matter, I believe. So the problem is, if I come down on the 4 issues, is the corruption is the highest issue. And when we see, as Dr. Madhumdar said, I've also read that top bank or the regulatory bank of Bangladesh has been involved in the corruption. We do not know how $100 million have gone from this high security bank. We don't know yet. We don't know what has happened to yet. And so there are a lot of stories. The doctors, the hospitals, the public sector. These are definitely the places which to be seen. The other area to be seen is the law and order, and particularly the law enforcing agencies. Because of this pandemic, because of this digital act, because of these other issues, they have become more demagogue than what they were. Therefore, problems in future or in post-pandemic are there situation, of course, but what would happen to them? Would the government take notice of it? Now the bigger question is that we have the medicine, which is in Bangladesh, which is probably coming more and more. But then I'm afraid the distribution of it is going to be very, very messy, I believe, because the distribution, whatever the first line and the first phase gone, how would it be administered in the public itself, and the public, the lower strata public? I don't know. I don't see any organization as such. Therefore, it would be better to, if the government wants, should also include those NGOs, as somebody said, those NGOs who have been working on immunization. If not, there we would see a bigger corruption in that sector as well. The other day, I think yesterday, it was said only 73,000 people have registered so far, and most of the people are not willing to take this injection. The point is that means that it has not been propagated well, and if that is the rate, and then we bring this medicine, as we said, this will be sold in black market. Will go into the black market. Don't go to the people in the absolutely in the lower strata. So I think there is a big challenge. Big challenge is, of course, economy. Big challenge are those that, though we say that our economy is still doing well, but then there's a big challenge would be this social decay. The big challenge I'm seeing at the education sector, and of course the big challenge still remains in the public health sector, whether pandemic or no pandemic. And at the end, I would say that the discussions that took place so far, and Dr. Ali Riaz and Dr. Amina Mohsin came out with the facts and figures. And of course, as usual, Bodhila Mujumdar has talked about the representation. We have been working on that, but there is no forceful voice. There is no strong civil society. I don't think we'll have a strong civil society very soon, unless the issue of representation is settled. Thank you very much.
Thank you, Dr. Shakot Sen, for your valuable speech. Professor Ali Riaz, if you have any final remarks, please go on. Professor Ali Riaz.
Thank you, Zilur, and thank you to all the participants and for their generous comments. Dr. Badilur Majumdar, Dr. Naina Mohsin, and Dr. Shakot Sen. There are a few issues. It seems to be we are on the same page. And the point that Dr. Majumdar has brought up, which I alluded to, that the COVID-19 crisis cannot be viewed, the governance of COVID-19 cannot be viewed separate from before, because not only in terms of economy, but also in terms of governance. The representational aspect, with the absence of a, morally legitimate governance, I call it, you may constitutionally, legally, juridical, legal measures may actually say that this is a legitimate way of governing, but I don't think it has the moral standing of the government. Hence, all these problems that we are witnessing is not going to go away. As I said, it could happen that on a fine morning, miracle, even if a miracle happens, which is not going to happen, but let's say it happened on a fine morning, on a Thursday morning, the COVID is gone. Will that take away the crisis of governance? No, it is not. The disparity that has increased. Yes, economy is doing fine in the large, broad indicators, but what about the disparity that has already was in place and now accelerated? Are they going to be getting back to the job tomorrow? Are they going to have the money they need, the livelihood they need? Are they going to get back? That's why the question of the governance that we are talking requires us to discuss it in a more comprehensive manner, which all of us seems to be alluding to. Hopefully, people who actually matters are listening to us. Are they going to listen to us when there is no mechanism of accountability? What is holding them accountable to us or the Bangladeshi citizens? We are a very small number in terms of that, whereas the larger Bangladeshi population has lost their voice. Dr. Majumdar has referred to the election system. The whole electoral system has been crushed deliberately. So the representation, without addressing the representational aspect, it is very difficult to talk about the governance first. What I have done, I've tried to look at the functional aspect. Let's at least get these things done, and the voices should be there. That's what I intend to do. And one of the most important things which I have not discussed, hopefully CGS at some point is going to discuss, which has brought up, education. Are we going to get a lost generation? It is a worldwide problem, but the digital divide that we have witnessed, and in case of Bangladesh, it is far more striking. Similarly in some other places in Africa and some of the Asian countries, even within the United States, this digital divide is causing a huge problem with respect to delivering the education. Even the plain and simple instruction, we are not talking about quality at this point. Plain and simple number game is that, So hopefully these things would come up. And Dr. Naina Mohsin has brought up the resilience of community level. And that's the fantastic thing that has happened in case of Bangladesh, and in many other places, but when we're talking about Bangladesh. But implicitly, that is an indictment of the state too. They didn't care about the state. Bangladeshi state has remained completely, away from this, and the community thought that they will have to stand and do what they needed to do, and they have done it. Thanks to them that they have done and showed the resilience. Hence, hopefully, these conversations would be listened to the people who actually matter and take into account. Hopefully, the path forward for Bangladesh should be better with respect to. But as I said before, the UNDP and the multilateral organizations who are coming forward, whether it is ADB, whether World Bank, the IMF, who are putting the money, UNDP, which has a commitment to the development, in not in the sense of growth only, development in the sense of development, human development, human security issues. They have a responsibility as well. And I would like to remind them that there is, on the other hand, for the media and the civil society, my plea to them that, rightly said by Dr. Shikar, that what is the difference between pre and during pandemic? There is none in terms of governance. So we need to speak out and identify those and be the voice. Absence of civil society is true, but it is incumbent on the media as well to stand up at this point. If they don't do it, they would be ignoring their responsibility at their own peril and the peril of Bangladesh. Thank you.
Okay, thank you again, Professor Riaz, for your time and thoughts and for the great presentation. It was a pleasure to have you with us, and our thanks to all the speakers, to my colleagues from the media, my colleagues at the CZS. So this concludes the webinar. Thank you all for attending. We hope you have enjoyed this session. Thank you very much.